Secretary. Ladies and gentlemen, please join me in welcoming the Secretary of the Department of Veterans Affairs, Robert A. McDonald.
Thank you. Mike, Commander Helm, thank you so much for that kind introduction, and more importantly, thank you for your tremendous leadership of the American Legion over the last year. Let me also acknowledge Dan Wheeler, who I visited recently in Indianapolis, and Verna Jones, who I work with every day, and the other members of the Legion's leadership team. Fellow veterans, ladies and gentlemen, working at the VA is a higher calling. We have the best, most inspiring mission in government. That's to care for those who have borne the battle and their families and their survivors. And we have the best, most deserving clients in the world. Recently, some people in Washington and in other parts of the country have begun to question the need for VA. One thing I've learned since my confirmation as Secretary is there is no substitute for VA. Veterans need the VA. Veterans need the VA. American medicine needs the VA. And Americans everywhere benefit from the VA. What's so special about VA healthcare? Well, VA's healthcare system is supported by three pillars, a unique system that depends on the strength inherent in all three of these pillars: research, education and training, and clinical care. VA researchers have made major contributions to medical science, earning 3 Nobel Prizes and 7 Lasker Awards, among many other recognitions. Among our achievements, the implantable pacemaker, cardiac pacemaker, the first successful liver transplant, the nicotine patch, the shingles vaccine, multiple advances in prosthetics and identifying genetic risk factors for numerous diseases, and in treating spinal cord injuries at our Bronx VA. Groundbreaking strides in treating the signature wounds of today's conflict, post-traumatic stress, and traumatic brain injury. We're affiliated with over 1,800 educational institutions, and we train 120,000 healthcare professionals every year. 62,000 medical students and residents, 23,000 nursing students, 33,000 students in other health fields. An estimated 70% of all U.S. doctors have trained with the VA, and we're the largest employer of nurses in the nation. Last year, we completed over 55 million appointments for 6.6 million unique patients. We're a national leader in telehealth services, caring for 700,000 veterans through over 2 million telehealth visits in fiscal year 2014. We're also a national leader in reducing MRSA infections. These are infections that occur in hospitals. They're down 68.6% since 2007, compared to 30% for non-VA hospitals. Since 2004, the American Customer Satisfaction Index has shown that veterans give VA health care higher ratings than patients at most private hospitals. VA researchers continue to receive awards for excellence, like the ones you see here. Take a look at the second bullet point. 26 years ago, Doctors Bill Bauman and Ann Spungen teamed up to find out how spinal cord injuries caused many parts of the body to function poorly. In 2001, they established the National Center of Excellence for the Medical Consequences of Spinal Cord Injuries, where they and others have worked to improve the quality of life for paralyzed veterans. Last year, they were honored with the Samuel J. Hyman Service to America Medal. Now, VA does face some serious challenges. The veteran population is aging. In 1975, there were about 2 million veterans 65 years or older. In 2017, there will be 10 million veterans 65 or older. 46% of all veterans will be 65 or older. Simultaneously, the number of claims and medical issues in claims has soared. As this chart shows, in 2009, VBA completed almost 980,000 claims. In fiscal year 2017, we project we'll complete over 1.4 million claims, a 47% increase. But there's been more dramatic growth in the number of medical issues in claims, and you would expect that with an aging population. 2.7 million in 2009, and a projected 5.9 million in 2017. That's a 115% increase over just 8 years. These increases were accompanied by a dramatic rise in the average degree of veterans' disability compensation. For 45 years, from 1950 to 1995, the average degree of disability was 30%. Since 2000, the average degree of disability has risen to 47.7%, as this chart shows. The percentage of veterans receiving VA compensation follows the same pattern. From 1960 to the year 2000, it was stable at about 8.5%. But in just 14 years, since 2001, it has more than doubled to 19%. So while it's true that the total number of veterans is declining, the number of those seeking care and benefits is increasing, fueled by the aging veteran population, more than a decade of war, Agent Orange-related claims, an unlimited claims appeal process, increased medical claims issues, far higher survival rates on the battlefield, and more sophisticated methods for identifying and treating veterans' medical issues. Veterans' demand for services and benefits has exceeded VA's capacity to meet it. It's important that Congress and the American people understand why that's happening. Compounding the problem, VA is saddled with some seriously aging infrastructure. 900 VA buildings are over 90 years old. More than 1,300 are over 70 years old. A full 60% are over 50 years old. These older buildings don't meet today's standards for hospital construction and need to be replaced with new buildings. The independent budget produced by the Veteran Service Organizations estimated that closing the major construction gap will take $19 billion to $23.3 billion, will take $19 to $23.3 billion over the next 10 years. Here's an example. This is an actual building owned by the VA in Minneapolis. It was built as a gas station in 1932. We wanted to tear it down and build a homeless shelter on the site, but the building's supposed historical value has made that almost impossible to do, so it's still standing. VA currently has 336 buildings vacant or less than 50% occupied. That's 10.5 million square feet, costing about $24 million annually. VA is committed to delivering timely, high-quality health care to our nation's veterans. We know that we still have far too many veterans waiting for care, but we're now providing more care for veterans than ever before, both inside VA and outside VA. To meet the immediate demand for access, we have extended hours, 880,000 appointments completed during extended hours. That's evenings and weekends. We've activated 80 buildings to add 1.3 million square feet to our healthcare footprint, plus another 420,000 square feet in VA-owned properties. We've stepped up recruiting of new personnel, 38,000 hired in the past 10 months, for a net increase of 12,000 VHA employees, including over 1,000 more physicians and over 2,700 more nurses. We've issued over 1 million more authorizations for care in the community, a 41% increase. Now, speaking of care in the community, VA has been referring veterans to care in the community for decades, whenever it made sense for veterans, and we're not opposed to making greater use of care in the community to meet the access challenge. But we know that many veterans prefer VA health care. In fact, a March survey of veterans found that 47% offered choice elected to wait to get their care inside the VA. 78% were satisfied with their VA care experience, and 82% would recommend VA care to fellow veterans. One more thing to keep in mind. Most veterans already have a choice. 78% of veterans have either Medicare, Medicaid, TRICARE, or some other private insurance. Many come to VA because of the disparity in out-of-pocket costs between their insurance and VA care. Here's an example. VA provides the best hearing aid technology anywhere. Medicare doesn't cover hearing aids, and most insurance plans have limited coverage of hearing aids at best. So choosing VA for hearing aids saves veterans around $4,200. We're providing regular updates of patient access data so you can see how well we're doing. No private healthcare system does this. No private healthcare system wants to be measured by appointment wait times. And it's not an accepted industry practice, but we're doing it. And here are the results. 7 million more appointments completed in the past 12 months. 2.5 million more within VA, 4.5 million more in the community versus last year. 97% of appointments are now completed within 30 days of the veteran's preferred date. 87% are within 7 days. 22% are same-day appointments. Average wait time for completed appointments, 4 days for primary care, 5 days for specialty care, 3 days for mental health care. More progress. 12% increase in after-hours and weekend appointments, 19% increase in telehealth, 36% increase in e-consults, 36% increase in the number of veterans receiving care in the community, 47% reduction in the electronic wait list, and 93% reduction in the new enrollee appointment request list. Overall, our physician productivity has increased 8%, and on a healthcare budget increase of only 2.8%. So you see, we are working harder and smarter, and the result is more care for more veterans. Of course, healthcare is just one of 9 VA lines of business. Other lines of business include life insurance, mortgage insurance, pensions, disability compensation, memorial affairs, and of course, education. We've got reasons to be proud in those areas too. We guarantee 2 million home loans with the lowest foreclosure rate and highest satisfaction rate in mortgage lending. For the past decade, the American Customer Satisfaction Index has ranked our cemetery system as the top customer service organization in the nation, public or private. In the past 2 years, we've cut the disability claims backlog by 84%. It peaked at 611,000 claims over 125 days in March of 2013. Just last week, it dropped to less than 100,000 claims, the lowest it's ever been in VA history. We've got more to do. Accuracy has also improved from 83% in 2011 to 91% today, and veterans are waiting much less time for pending claims. In March of 2013, the average wait was 282 days. Today, it's below 105 days. That's a 63% increase. How did we get there? Well, we fielded a new electronic system for handling claims. We hired more claims staff, and we've had them working mandatory overtime for much of the past 4 years. Now, the mandatory overtime can't go on forever. To keep the backlog down, we need to right-size our claims staff, which will require more funding. If we don't fund a requirement, we can't be expected to meet our requirements. As you see here, we've also made substantial dent in veterans' homelessness, which has declined 33% from 2010 to 2014. Ending homelessness is a local effort, so we're working with over 2,000 partners all over the country. Of course, to meet the challenges of the 21st century, VA will need adequate funding. The President's 2016 budget request would provide the funding we need: $168.8 billion, $73.5 billion in discretionary funds, and $95.3 billion in mandatory funds for benefit programs. The discretionary request is an increase of $5.2 billion, or 7.5%, above the 2015 enacted level, providing resources to continue serving the growing number of veterans seeking care and benefits. But if the President's budget request is cut by $1.4 billion, as the House voted to do, here's what it would mean if we applied those cuts across the board: $688 million less for veterans' medical care, the equivalent of over 70,000 fewer veterans receiving VA medical care. No funding for 4 major new construction projects and 6 new cemetery projects. The House would inhibit hiring and retention of the best people by limiting the right of employees to appeal adverse actions and by prohibiting performance awards and bonuses for Title V, SES, and other employees. The House would also deny VA the long-term budgetary flexibility needed to serve veterans the way they want to be served. Budget flexibility is extremely important. Demand for VA care is rising for reasons already mentioned. Veterans are turning to VA for more of their care, but not for all of their care. On average, enrolled veterans relied on VA for just 34% of their care. But if that percentage increases just 1 percentage point to 35%, our costs increase about $1.4 billion. Congress acted to avert an end-of-fiscal-year crisis by giving VA limited flexibility to use Choice Act funds for care in the community to cover a shortfall in funding for care in the community. But that flexibility lasts only until the end of this fiscal year, September 30th. To accommodate present and future changes in demand for care, VA needs permanent flexibility to move funds among accounts. We need to be able to move money to where the veteran goes. VA is committed to making the Choice program work. Here you see our progress in the use of choice authorizations for eligible care in the community. Now, Choice doesn't cover everything, but for what it does cover, authorizations are now over 50%. But we still need Congress to fully fund the President's 2016 budget. And we need Congress to give us the permanent flexibility to move funds to where it's most needed based on where veterans choose to get their care. I mentioned earlier that some people in Washington are questioning the need for VA. Others have attempted to squeeze the needs of veterans into a sequester budget that artificially constrains the budget regardless of what it means to the programs we're trying to operate within the VA or across the government. All of this, lack of flexibility to give veterans real choice, the cuts, the discussions about whether veterans actually deserve a medical system to call their own, all leads to the same place. It leads to a place where the needs of veterans are secondary to ideology, where scoring political points or short-sighted budget policies are more important than veterans, a place where VA is set up to fail, a place where there are no winners, and veterans who have sacrificed so much for much nobler purposes are the ones left suffering. That's unacceptable to me, and it should be unacceptable to anyone who claims to actually care about the sacred responsibility that we as a nation have to care for those who have borne the battle. That's why I'm here, and that's why you're here. And that's why we all need to make sure our voices are heard and that we press forward in putting veterans first, not ideology. Now, you should know we are listening hard to what veterans, Congress, employees, veteran service organizations are telling us. What we hear drives us to a historic department-wide transformation, changing VA's culture and making the veteran the center of everything that we do. We call it My VA, and it entails many organizational reforms to better unify the department's efforts on behalf of veterans. First, we want to improve the veteran experience to be seamless, integrated, and responsive to the veteran's need. Second, we want to improve the employee experience, focusing on people and culture to better serve veterans. Third, we need to improve our internal support services, like our IT systems. Fourth, we need to establish a culture of continuous improvement, and we're going to use Lean Six Sigma to do that. Fifth, we want to enhance strategic partnerships. There's a lot of goodwill in this country to help veterans. We want to make sure they're in the tent and helping VA. The key to improving the veterans' experience at VA is a customer service approach. I call it the Platinum Rule. You've heard of the Golden Rule, I'm sure. Treat others the way you want to be treated. Well, the Platinum Rule, I think, is a bit higher standard. Treat others the way they want to be treated. Their perspective, their needs, their wants, that's all that counts. Focus on the customer. From their perspective, we've already taken several MyVA steps to improve the veteran experience. Here you see a few examples. We also brought aboard several key leaders with broad experience in business. 11 of my 18 direct reporting senior executives have joined VA since my swearing in, and the entire leadership team is as committed as I am to making VA the #1 organization in customer service. Now, there's so much more I could tell you if we had the time. More that we've accomplished, but perhaps more importantly, more that we will accomplish in the coming months. We're listening to veterans more. We're listening to employees more. And together we're making lasting improvements at VA so that in the future, veterans will say with pride, "That's my VA." But we need the continued support of Congress, of veterans, of veteran service organizations, of the American people to make the necessary changes to keep moving forward. And I know we will do that with your help. May God bless the veterans of this country who have done so much for all of us. May God bless the United States of America. May God bless the American Legion. Thank you very much.